Have you had difficulties taking care of a patient who have had a stroke? Welcome to Wellness Health Services. I'm Dr. Derito Joshua, your family physician. Today we will be talking about taking care of a patient after a stroke. From our previous talk, a stroke is a sudden interruption in the blood supply to the brain, either by a blood clot, whereby there is a blockage and there is no blood supply to the remaining part of the brain, or there is a rupture of a blood vessel supplying a particular part of the brain, making that part of the brain have inadequate blood supply. So how a person is affected is dependent on the part of the brain that is affected, and there are various complications that can be encountered. One of them being loss of sensation. There could be loss of balance. There could be decreased level of consciousness. There could be complete or partial blindness, or there could be difficult swallowing. So an attack on the left side of the brain can cause weakness of the left side of the body. There could be problems with the vision. There could be challenges with behavior, and there could also loss of memory. As a stroke on the left side of the body causes paralysis of the right side of the body. There is loss of speech and language. There could be slowness of actions, and there could be memory loss. So some of the challenges that are encountered after a stroke include loss of the speaking ability, difficult forming words, difficult putting words into words, and also difficulties with the understanding language. So these individuals will have what we call in medical terms aphasia, or loss of speech. And so when you have someone who is suffering from this situation, the first thing is when you are talking to them, try to get their full attention. Speak clearly and slowly, and then express your ideas with the heart, or you can also use gestures to try to communicate with them, and the improvement occurs slowly with time. Individuals who have suffered from a stroke can also affect their mood, and they may suffer from depression, especially that they are not able to do things for themselves. They get embarrassed for getting assistance for everything. And some of the signs that someone might have depression include loss of interest with previously enjoyed activities, unusual sleep pattern, loss of appetite. And so the care for these individuals include try to help the person to be as independent as possible. Whatever they can do for themselves, you help them to do it. Have a routine way of doing things so that they also can develop their own functions. Help them to use maximally the side that is not affected, and also help them to adjust to their environment. So for a person who have developed weakness on one side, there could be need to adjust their environment. You have bars to hold on to, raised toilet seats, use of a bathtub, developing and adjusting the shower place, and also help them in their dressing. So put clothing on the affected side first. When undressing, put on the clothes on the affected side last. Avoid clothing that must be buttoned or which need to be pulled over the neck, and also putting on clothes that are easy to undress, and also have something that does not need to be buttoned up, because the individuals will have difficulties trying to button up. Assistance with nutrition will include adjusting the diet so that they can have food that are not difficult to swallow, more like liquid-like foods, so that they can swallow with ease, especially if they're having difficult swallowing. Be patient in their feeding. Help them to take part in the feeding process as much as possible. And also have them be turned every 2 hours so that they avoid the pressure sores. Have sometimes use of what we call lipo mattresses. These are mattresses that have air pumped into them, and they help to keep the patient turning. So when you have a patient with a stroke, they become dependent depending on the level of the side and the part of the brain that has been affected. Their activities of daily living will be affected in various ways, including speech, loss of sensation and power in one part of the body, or they may have loss of consciousness, and they may have difficult swallowing and also have difficulties in speech. So you need to understand this and help them slowly. The recovery process might take a long time, and it is dependent on the part of the body that is dependent, is involved, and they require a lot of patience for them to gain functions. So they need family support, they need the family to pull up together so that they are assisted and they do not develop further complications. It's also important that they continuously keep seeking medical help, because the happening of one stroke is an indication that there is the process of vessel blockage is happening, and they may have other complications. So they need to be on drugs to help them avoid another stroke. They need assistance with the activities of daily living, and they need process to be rehabilitated back to normal living as much as possible. Thank you for listening.